What I would say about it is you're absolutely right, and one of the messages that I wanted to make it, to bring home is it's incredibly important that we as community folks who are affiliated with organizations and institutions that have a potential to impact those panels that are going to be making the decisions about what's included. So for example, HIV, currently there's still a question as to whether the screening for HIV will be included in that prevention group, or the very significant amount of resources that are characterized as chronic disease funding in the bill. There's still a question as to whether HIV will get any of that money, and it's this real catch-22. I mean, you hear people all the time talking about how we've moved into the chronic disease management model, and yet as soon as there's money on the table for chronic disease, we suddenly become infectious and become excluded from the pot. And that has happened now 3 times with 3 separate pots of money. We have to make sure we don't allow it to happen this time. So yes, the CDC is really in a good driver's seat to, for the first time in a very long time, infuse a lot of our systems with some good preventive health resource, but we have to make sure that it's targeted appropriately.
And I would add that we do a lot of work around prevention, and the way that we talk about it is, why is prevention different for our community? So, for example, a couple of years ago, the Department of Health and Human Services came out with, what does it look like to be a healthy woman of childbearing age? And what it basically said was, because the rate of unintended pregnancy is so high, women should be on prenatal vitamins from basically 18 on. And it was like, I'm not gonna get accidentally pregnant. Like, I'm quite aware of what my risks are, and that is not one of them. So for us, when these prevention things come out, we have to say, does this apply to our community? So does that apply for women who really only partner with women? When you're saying the word woman, are you talking about women who may need a prostate exam as prevention care? What does that look like for us? And until we actually break that down to the very kind of specific details around what LGBT care looks like, people just don't know. So we have to do that very basic education and talk about, what does it look like to have culturally competent care? Do you know to do an anal pap? What does that mean? What does that access look like? And as these prevention things come out, to read them over carefully and make sure that their definitions of what healthy and normal looks like is what our community's definition of what healthy and normal looks like.
And I always struggle with this very model, and that we talk about at Mazzoni and other places I speak about all the things that are wrong with our community and how do we combat that. However, I have so many patients who do really well. They're very healthy. They do all the right things, not because I ask them to, but because they're healthy people. And they live very healthy lives. And what I see in the community is that doesn't get highlighted. And so particularly when we deal with adolescents, we don't see role models that show up. Perhaps we're doing better on TV and in the media, but we certainly don't see a lot of that. And so I think it's about, possibly from a grassroots effort, saying, Mazzoni, we need to sponsor something that said, this is healthy Philadelphia LGBT community. Let's celebrate that. And where do you get funding for that? I don't know. Perhaps we need to push for that, but I think that's something we could probably do without a lot of funding, and I think it will have a huge impact on the community. How do you measure that to see that it has an impact? That's a whole different question, but I definitely see an opportunity there.
And I think of it as resiliency. In the Black gay community, we have been focused for the last few years on a CDC 5-city study that showed 46% median HIV infection rates in communities in 5 cities across the country. But we rarely talk about the 54% of folks who were uninfected, and what have those folks done right to remain uninfected. There's a history of resiliency in our communities that sometimes in our advocacy efforts to sort of make the case, we haven't been as well skilled to sort of incorporate it in, because maybe we're fearful that it undermines the ability to sort of make the most dramatic case to get the resource. We've got to start doing both, because I think it sends mixed messages to the community at large if we don't. You know, if you're always sort of beating people over the head with you're bad, you're in trouble, things are lousy, then you don't reward and acknowledge and inspire people to continue in those instances when they're doing things that are really commendable, to continue to do them. So it's really a point well taken. It's something that I know that a number of the groups that are focusing primarily on prevention issues are really looking at, because we're a little fearful that we may have unintendedly over time incentivized some things that have exacerbated the problems.
And I am not the touchy-feely person, but I think that this answer is fairly touchy-feely. And I would say we often talk about, well, what happens when you go to a transphobic doctor, right? What does that do to your mental health? But we don't say what happens when you go to that doctor and then you hang out with your friends, and your friends in your community make that situation better, right? And you show each other love and you show each other support, and you say the next time you go to the doctor, I'm going to go with you so that it's better. And we often just talk about, well, being LGBT, we have all these discriminations, but we don't talk about what it's like to have a community that supports us, to have our chosen family that shows us unconditional love, and how much that does for our mental health and how much it does for our physical health too.
I can certainly address that. In one of my other previous lives, I was a Soros Foundation Fellow, and one of the goals of that fellowship was, well, several-fold, but one of them was to look into family medicine in particular, and pediatrics, and changing some residency, not qualifications, but some recommendations about what people should learn. There are so many things on the agenda of the people writing those that this very often gets left out as it's not as important as domestic violence. It's not as important as talking about race. And it was a large struggle. I was not successful in changing it within my own discipline. That is the main barrier, is that there are so many months in a year and there are so many things that have to be taught that it's not something that has risen to the point where they mandate it. Now, that being said, I operate in a residency program where I make sure that in my residency program that's taught, but at 9 residents a year, that's only 27 people that I get to touch every year. So, but thank you for allowing me to talk at your place.
There's also an awful lot of incentive money in the bill. We did successfully, I think all of the health groups made the case that it was going to be a problem to continue to talk about accessibility with such a severe shortage of physicians in the pipeline, pretty much of every stripe, not to mention nurses and PAs and NPs. And so there's a lot of money in there that incentivizes folks to go into specific types of medicine. And it seems to me that when you're incentivizing folks and you're forgiving loans and you're encouraging people to go to various regions that are underserved in order to sort of meet various needs, that there are ways, it seems to me, that we could push the envelope to get some messages to those folks if we are at the tables when those decisions are being made. And they're being made over the next, I would say, 8 months. That's when all of this stuff is being written up. So I just once again say, look at all of those committees and panels and review boards that are embedded and nested all through this legislation that are going to be making all the implementary decisions across the board, and make sure that we know somebody on there to make the case.
And I would also add one more thing. When we struggle with this a lot at the coalition, we have a lot of internal conversations about, does it make sense to push for an LGBT separate, or does it make sense to weave it in throughout? So you can't talk about domestic violence and not talk about us, right? You can't assume that woman who is right. No, I'm saying, but saying to healthcare providers, you're in the ER situation, you have a woman come in, you think she's there with her female friend who's protecting her from her abusive husband, but really that's her abuser, right? You can't just talk about race without thinking about LGBT people of color.